Welcome to Staying Connected, a podcast where I talk to people about their stories with VEDS, Marfan, Loeys-Dietz, and related vascular and aortic connective tissue conditions. This is your host, Katie, and before we get into the show, I want to remind you that the views, information, and opinions in this podcast are those of the individuals involved, and the information presented does not constitute medical or other professional advice or services. Any opinions that I express in this podcast are my own and not of my employer. Hello. We are back together again for a new season, which will stretch from now until the end of December with a new episode every Saturday. The first episode of this season is with Delaney Kinstner, who will share her experience with Vascular Ehlers-Danlos Syndrome, or VEDS. Before we go over to the interview with Delaney, I have a quick announcement to those in our community with VEDS or with an immediate family member with VEDS. Maya Brown-Zimmerman, who was previously on this show sharing her experience with Marfan syndrome, is currently running a VEDS research study called The Role of Community in Mental Health, a Grief and Trauma-Related Needs Assessment in the Vascular Ehlers-Danlos Syndrome population. She's hoping to get responses from multiple people in a family when possible, and the study is open to parents, partners and spouses, and/or siblings who don't have VEDS, as well as people with VEDS, 13 years old and older. I've put a link to the survey in the episode show notes. Also, if you like this show, consider supporting this work by joining my Patreon. My supporters on Patreon make it possible for me to continue producing this podcast, and you can join and help this show continue to reach people around the world for just a few dollars a month. But whether you support this show through the Patreon or just by sharing it, it all helps. So thank you. Let's get into the show. Hey, Delaney, thank you so much for coming onto the podcast to share your experience with Vascular Ehlers-Danlos Syndrome, or VEDS. Why don't you go ahead and introduce yourself to everybody who's listening, your name, where you're from, anything you want to mention.
Hi, Katie. My name's Delaney Kinstner, and I was diagnosed with VEDS just about 2 years ago. We're coming up on the anniversary next month. And my almost 2-year-old son was just recently diagnosed with VEDS also in July, so a couple months ago.
So how did you come across this? How did this diagnosis occur?
My husband and I decided to get pregnant, and I had an uncomplicated pregnancy in regards to VEDS things. I didn't know I had it at that time. But my pregnancy was fine. It was like any other pregnancy. My water did spontaneously break 7 weeks early, and I delivered our son via vaginal birth, pushed. Everything was fine. I had a really bad tear, so I had some surgery right after labor, but everything was fine. He went off to the NICU because his lungs weren't fully developed, and we did the NICU thing for a week. And then a week later, about 10 days actually, I woke up in the middle of the night with what I thought I was having a panic attack. And I couldn't get my heart rate under control. So I turned to my husband, Logan, and said, we have to go to the hospital. And we got to the emergency room, and they basically whisked me back within 2 minutes, and we knew something wasn't right. They put me on in one of those big rooms like you see in Grey's Anatomy with the big overhead lights, and all of these people were coming in and out, and nobody was really saying anything to us. And they're taking off my shirt. They're putting on the resuscitation pads, like the shock pads. And I'm like, why are you putting those on my chest? And at that point I was starting to have difficulty breathing. And I remember looking at Logan across the room and saying, I'll be okay. I'm going to be fine. Because at that point in time, I thought I was dealing with postpartum preeclampsia. I thought I was dealing with high blood pressure, because that's what they said to be on the lookout for in the postpartum period. So I was just hyper vigilant of that. And I was a NICU mom. So I was driving an hour to go see my son every day. I was trying to pump. This wasn't even in my wildest dreams. And the last thing I remember is an oxygen mask coming at my face. And that was October 10th 2021. And I woke up in Northwestern Memorial, downtown Chicago, a month later.
So you were in a coma that whole time, or what?
So they didn't technically call it a coma. I was on ECMO, which basically is a machine that takes the blood out of your body, oxygenates it, and pumps it back into your body. It was like a external mechanical heart. I was on a ventilator. So I was on life-saving machines to keep me alive, but I was medically sedated to keep my body from fighting. What they needed my body to do was to just take a break. They ended up finding that I had 2 coronary arteries, the 2 veins on the outside of my heart had burst. I had a dissected carotid artery, and my mitral valve in my heart was leaking all over the place. So I had emergency surgery the day after, on the 11th, and then October 11th, I had emergency open heart surgery downtown. They replaced my mitral valve, so I have a bioprosthetic valve. That's a pig valve, and they stitched it together. And at the time, they still didn't know that I had VEDS.
Yeah.
What the doctor, well, my surgeon describes it as is it was like stitching together tissue paper, wet tissue paper. Mm-hmm. They kept my chest open for 2 weeks because they had to keep going in to the valve to clean it out because my tissues were just so damaged. I had stents put in my carotids to prevent blood clots from going to my brain. I ended up having a blocked femoral artery because of all of this. So the vascular surgeon on the team eventually did surgery on that too. I was lucky to get my toes back. I actually, because of the ECMO and the vascular issues I was having, my toes and my fingers turned purple. Even my nose turned purple because they were taking all of the blood out of my extremities and just keeping it in my vital organs, basically.
I'm trying to put myself in your shoes here. What was the experience like when you woke up in November?
Very disorienting. I don't remember everything. I definitely have memory loss. I went through what they call ICU dementia in the hospital. And I have lasting memory loss from the trauma that I went through. So I don't really remember a lot of things. I do remember waking up and being disoriented and not really knowing where I was or why I was there. But the lasting feeling that I never felt scared. I never felt scared. Frustrated, absolutely. Mad, pissed, actually, absolutely. But I don't ever remember feeling scared. I have a lot of trust in our medical community, and it was almost like a relief because I've always known that something was wrong. Not wrong, something was different about me.
Mm-hmm. Let's talk about that some more. So did they test you for VEDS while you were sedated, or did that come after?
They tested me while I was sedated. So I actually didn't get a confirmation that I had VEDS until like the week before I woke up. So I was in the hospital for 3 weeks, really, before they got the confirmation that I had vascular Ehlers-Danlos. They talked about a lot of things. They talked about bleeding disorders. They talked about rare, chromosomal disorders. I couldn't even tell you what the names are. And this is all information that I've received from family since then. And it was a last kind of ditch effort to figure out what was wrong and why my body was reacting to things the way that it was.
Yeah. And you mentioned this feeling like something was different, like that you always knew. So what made you feel like that in your life?
Growing up, I played sports. I always played soccer. I played basketball, played volleyball once I got a little older. And I remember as a kid struggling with popped veins, exploding veins, and just the pain that's associated with that, the abnormality that wasn't happening to other kids. Why was it happening to me? And then ultimate prevention of playing sports once I got to high school. I found a love of volleyball in middle school, but I couldn't continue once I got to that more competitive high school level. One, because my wrists and hands were black and blue all the time, just because that's where the impact of the ball. But I also struggle with some of that elasticity, that hypermobility that people who have just, your traditional hypermobile Ehlers-Danlos have. So my shoulders are very hypermobile. So they're very weak. And I can't serve a volleyball to save my life, which was really frustrating. I did everything because I was like, why can't I do this? But anything I did just didn't work. So I ended up having to give up sports. And then I started to get varicose veins in high school. So here I am, I'm 16 years old in high school, and I have to wear compression stockings because I have varicose veins. And the doctors at that point were like, oh, well, you just, have bad genes. You just got the short end of the stick. Yeah, that's not what it was.
Yeah. That's so many things that people in our community have dealt with. And very, very VEDS. I mean, it's fun. It's kind of ironic that they're like, oh, you just have bad genes, but then there is no referral to a geneticist.
None. No, it was just, oh yeah, you just have bad luck. Yeah. I'm like, what? I'm 16 years old. What do you mean I have bad luck? This shouldn't be happening to a 16-year-old.
No.
Yeah. I was tested for von Willebrand's, which is, I've learned, common to be tested for prior to being tested for VEDS. As I'm on this journey, I was tested for von Willebrand's, the bleeding disorder. And of course, it came back negative because that's not what I have. And it was very frustrating. I remember talking to my mom after I got out of the hospital, and she almost blamed herself. She was like, I'm sorry I did this to you. And I was like, Mom, this isn't your fault at all. Are you kidding me? It's not a failure on you as a mother. You did everything that you could do, that you could think of as a mom. You're not thinking about these rare symptoms or these rare disorders when you're just trying to figure out why your kid's bruises really easily.
Right.
You know what I mean? Like, that's not what you're thinking about.
Yeah. I mean, like, your job as a parent is like to do the best you can to advocate for your kid. But ultimately, it was not her responsibility to figure out all of those pieces and put them together. Like, if the hematologist says, no, your kid's fine, that's not on her.
No.
And that's such a common thing that we hear is like this referral to hematology, everything's normal, and then nothing happens.
The ball gets dropped. Yeah.
Yes. Yeah. So what did this feel like for you, getting this diagnosis? Was it a relief, or was it like, how did all of that feel?
It was a little bit of relief and frustration. It was relief because there was finally a name to it. There was like, I knew something was wrong. So there was the relief of there that I'm not crazy, and that the things that happened to me, there's a reason for it. I don't just have bad genes. and that there's other people out there that are experiencing what I'm experiencing. So there was a little bit of relief in that. In the hospital, and the one thing that Northwestern Memorial does a fantastic job of is on their cardiac teams, they have a specified cardiac psychologist on their teams. And that's not common practice everywhere, I've learned. And I was very fortunate to have a very specific professional on my team that was around the entire time. They were with my family when I was in the ICU, and then she was with me when I went to a step-down floor before I went off to rehab. And she would come in and we would talk about just the struggles that I'm feeling that day or things that I'm thinking about for the future. It was like, well, what are you thinking about when you go home, when you get to go home? You know, what are some things you're thinking about? It was about recovery, talking about recovery of a cardiac patient and the stress that comes along with knowing that you now have this disorder that is life-threatening, and dealing with that, coming to terms with the fact that I have something that can take my life in an instant.
Yeah. That's so great that they have this cardiac psychologist there to help with that. And I think that's an incredible thing. Did you get the diagnosis for your son? Like, was he tested while you were, like, around the same time that you were? Or, like, when did that happen?
So he got tested after he was a year old. That was the recommendation from my genetic cardiologist. Dr. Wilsbacher is my genetic cardiologist, and that was her recommendation. And her other recommendation was get him life insurance before. And I just, like, for parents, if you're not sure, but you think, make sure that they have life insurance beforehand.
Yeah.
And so that was the recommendation that all the professionals told us. And so we waited and we got him tested. He was a year and a half when we finally got him tested, and they were able to do just the cheek swab.
Nice.
Which is how I ultimately ended up getting the results back, was it by a cheek swab. And she was actually the one who called me and told me. So we have him set up to go through his first set of scans and meet the pediatric team downtown Loeys in October also.
Wonderful. Is he your only child? Did you have another one after this?
No.
Okay. I feel like I knew that answer, but I just, like, wanted to.
It's been a hot topic on our genetically confirmed Facebook page lately. I've seen quite a few posts about mothers and women asking about pregnancy and childbirth, and he is our only, and he will be our only that I will conceive.
Do you want to have other children via other methods?
I would love to. I would love to have another child. The option for us would be surrogacy. Mm-hmm. And that's something that we're just starting to dip our toes into after some pretty heavy conversations of, what if I accidentally get pregnant? What do we do? And having those really challenging conversations with my husband and then my doctors. Well, what would happen? You know, what are the recommendations? What would we do? Those kinds of things, because accidents happen. Even though you do everything that you can, it still happens. Mm-hmm. So that's something we're just dipping our toes into.
Yeah, that's a lot to wrap your head around and to think about, especially after everything that you went through. Yeah. So you mentioned the Facebook group. When did you kind of get connected with other people with VEDS? Are you the first in your family? Or like, how has this experience been since that diagnosis?
I am the first in my family. So it took me a little over a year and a half to really kind of go, okay, Delaney, it's time to figure this out. Because of the trauma that I went through in the hospital and the significant rehab that I needed post-hospitalization, I've really been focused on recovery and just getting home and being a mom to my son. And it wasn't until this summer that I finally felt like my mental health was in a place that I was ready to open it up to more information, to others in the community. Because when you do that, you're also opening yourself up to other people's trauma and other people's stories, which can be very difficult if your mental health is not strong.
Yeah.
And there are definitely times where I'm like, nope, I can't do this today. Can't think about it today. So I don't look at it. I don't think about it. I forget it exists.
What was that experience like this summer?
So this summer I went to the conference that the Marfan Foundation put on as kind of my first big, I just stepped right in, and it was very overwhelming. I went into it really anxious about meeting people, about the information I was going to receive, about making friends. And I think overall, I took out of it what I wanted to. I got the information, and then I made some friends along the way. And I found ways that I can be connected, but still protect myself. And I'm very appreciative of that.
Let's dive into that a little bit more, because I think that's a really important thing that you're talking about here, this, protecting yourself from further trauma, especially while interacting with other people who have had trauma themselves. How do you do that? Like, what method did you find?
One thing that I've learned throughout the years of therapy, quite honestly, is that self-realization and that self-analysis, and really consciously going into a situation, whether it's new friends, old friends, family, whoever, going into a situation, especially after a large trauma, and saying, how do I feel today? And being real with yourself. That's what I've pulled from. And then honoring that. And honoring the fact that I'm not up for it today. I don't want to talk about this today. And then letting other people know that and being okay with that. As a former people pleaser, there are just things that I can't do anymore. And I have to be okay saying no.
Yeah.
And that's really hard. It's very hard.
It's so important.
But exactly, it's so important. And it has absolutely protected me from additional trauma.
Yeah.
At the hands of people who love me. Your family and your friends, they care about you. And they don't mean it in a bad way. That's why you have to really take that step to say, nope, not today.
Yeah. So I want to dive into the experience of having all of the symptoms that you had before all of this, and then, ending up with this really major event and after 10 days after delivering your son and everything. And maybe it's a good opportunity to ask, what you want medical professionals to know. Like, I just feel like there's whenever I hear stories like this, there's such a big, when we know about VEDS, we know, and we know the symptoms, and we're just like, oh, it was so obvious, but it's not. Mm-mm. If you don't know what to look for. So I guess my question is, what do you want medical professionals to know? Or what do you think about that? That whole experience, what was that like?
Yeah. When I think back on my specific story, I do see a huge gap between the symptoms that I was experiencing and my event. I had never had any symptoms related to my heart, any, prior to my event after giving birth. Yeah. It wasn't even in my realm, my sphere of possibility. I was 28. I'm a 20, at the time I was a 28-year-old healthy woman. I had nothing to go on besides the fact that I had varicose veins and I would wear compression stockings every once in a while. Yeah, my skin's a little veiny, but I've gotten over that. It used to bother me as a kid, but now I'm like, yeah, it's just the way I am. So what? I do see a big gap in between my symptoms and my story. And I honestly don't know if there would have been any markers to, maybe prevent an event. When I talk back with my team and I said, well, what did happen? Why did this happen to me? Was it the pregnancy that put me over the edge? Was it the labor that put me over the edge? The pushing and the, increase in pressure. And they're like, no, you were fine. If something was going to happen, it would have happened right then. But because there was such a delay in my event, they think it had something to do with what they call that fourth trimester, that postpartum period where we don't have a lot of data in the medical field about what your body is doing and how it's connected to all the other systems in your body. I guess my ultimate goal, and it sounds kind of cliche, but listen to your patients. If something's bothering them because they feel like it's not right, listen. I shouldn't be 25 and going to my general practitioner and saying, why do my veins keep popping? That's not normal. That's not normal.
No, it's not.
It's not on the spectrum of normal. I get that medicine is a spectrum. Life is a spectrum. I mean, I'm a speech language pathologist and I work with kids. Development is a spectrum. But that's not normal.
Yeah. And that's, there's something else I read on that. And I feel like I saw it on a WebMD page or something like that, where if you are reading about easy bruising, it's it might just be more if females, and I just don't know if I believe that. I'm just not sure. I never dove into the research on it, but it just is chalked off to being female.
It's ridiculous.
Women bruise more easily. And I don't know why that would be. And maybe there is some truth to that, but it still does not encompass the range of bruising that happens with VEDS, I don't think.
No. And the person, I forgot who it was on my team, but at some point someone said to me, doctors look for horses, not zebras. Meaning that they're looking for those common symptoms, those common things that you see in the majority of the population. They're not looking for the outliers. Well, when you have a patient that's complaining to you on several occasions and has documented proof throughout their life that something like this keeps happening to them, that's when you need to start looking for the zebra.
Yeah.
Because you've run out of horses.
I love that analogy. I love the flipping of that analogy into you don't never look for those zebras. And that's, I think, what a lot of people run into is the looking stops.
Yeah, they've looked in their paddock, right?
Yeah.
In their paddock, they haven't walked over to the zoo.
Yeah.
And that's their job as medical professionals.
Yeah.
Is to bridge the farm to the zoo. Is to bridge. That's their job, because I can't do that.
No,
you want me to go on Google and start to do that? Are you kidding me? I think I was
then you go in with
dying
Google
with a brain tumor.
Yeah. You go in with all your Google information. And don't play Dr. Google. So you can't win.
Exactly.
Yeah. I love that analogy so much. I'm giggling at it because the whole thing is it's the farm and the zoo and it's perfect though. It's absolutely perfect.
I work with preschoolers. I talk about animals all day. Sorry.
I love it. I love it so much. So what advice would you give to somebody else that went through what you did? I mean, when I think about ECMO, that to me as somebody with VEDS is incredibly scary, and ECMO, I think, is a very scary thing for someone who does not have VEDS. And you went through so much during that period of time, just a lot of time lost. Mm-hmm. What kind of advice do you have for somebody who is maybe going through something similar?
Take it one step at a time, and literally one step at a time. I had to relearn how to walk, and I had to take it one step at a time. It's something that you will deal with the rest of your life. It will not go away. And that sucks. But you will get better. Another thing that the cardiac psychologist really helped me with in my recovery was changing my I shoulds to I will. That helped me tremendously. When I'm sitting in my hospital bed and I'm thinking, I should be able to do this. I should be able to type a text message on my phone, but I couldn't. I should be able to use a pair of scissors to cut out a turkey because I was in there over Thanksgiving for OT, but I couldn't. So instead of thinking, I should be able to do that, flipping your mindset to, I will be able to do that. It helped me get through rehab.
I think that's wonderful advice. Truly. It's really, really important. And I hope that, if you're out there and you're going through something like this,
you will get through it.
You will. Do you have anything else that you want to share with the listeners that we didn't cover today?
You're not alone. I thought I was alone. I thought I was the only person that felt the way that I did. And my family, as great as they are, they just didn't understand. But you're not alone. And when you're ready, reach out, but only if you're ready. Just know that we're here for you.
Definitely. And if you are out there and you are ready, there are links in the episode show notes where you can get in touch or find support through the VEDS movement. I think it's probably one of the easiest ways to get involved is just kind of, go to one of those support groups or something, and then you'll get reeled into everything else whenever you're ready.
One step at a time.
Yep. And if you're not there yet, I love that you included that. If you're not there yet, it's okay. It's okay. Thank you so much, Delaney, for coming on and sharing your story.
Thank you.
I really am so grateful to have met you.
Yes, I'm so glad we met at the conference.
Me too. I just love it. I'm so glad you're there, and I can't wait to keep staying in touch.
Yeah, absolutely. Thank you so much.
Thank you. Thanks so much for listening to this episode of Staying Connected, featuring Delaney Kinstner sharing her story with Vascular Ehlers-Danlos Syndrome, or VEDS. If you're ready to get involved or meet others in the community, check out the episode show notes for links to online support groups. October is VEDS Action Month, so it's also a perfect month to get involved with the VEDS movement. On October 25th, the VEDS movement is hosting a virtual costume party get-together. You can also join the Marfan Foundation and a number of events coming up soon. The Pittsburgh Regional Symposium on Marfan, Loeys-Dietz, and VEDS is next weekend on October 28th, and the LA Regional Symposium is November 4th. There is also a Walk for Victory coming up in Nashville, Tennessee on November 4th, and today, October 21st, in Cleveland, Ohio. And there's walks in many other cities with dates coming up soon. A link to these events are in the episode show notes as well. Next week, we'll talk to Dominga No, who will be sharing her experience with Marfan syndrome. If you like this show, I hope you will consider sharing it with your friends on social media to raise awareness of all of these conditions. And you can also support the production of this podcast by joining my Patreon. Thanks so much, and I will see you soon.